and go through the PowerPoint presentation that I have. So here we go. Okay, slideshow beginning. All right, so let's see. This is what my book looks like, Held, Showing Up for Each Other's Mental Health. It's published by Skinner House Books, which is a UU publishing house that publishes things mostly for things being used within, books being used within a congregation. And the audience of the book that it's written for is every member of the congregation. So it's not just for ministers or not just for the leaders, but it's something that I think everyone could use. And I like the title too. I didn't pick it. It was Skinner House that picked it. And I was really happy to see what they picked. So here's what I'm going to talk about. First, just a little bit of introduction to the subject and a definition of some terms. And I'll tell you a little bit about my own personal story and why this is so central to what I do in my ministry. And then I'll talk about mental health ministry and the elements of it and some stories from my own life and practice. And then talk also about, introduce the idea of how mental health is a social justice issue. And I have some resources, and then we can have question and answers at the end. So that's what I'm doing. So Josh introduced me already. I've been a UU community minister since 2004. I'm affiliated with Mission Peak UU in Fremont, California, and the focus of my ministry is mental health issues. I work as at an organization called Life Reaching Across to Life. It's a peer support organization, and I'm the assistant director of that. I've been there for about 20 years. And I am the board president of a fairly new organization called the UU Mental Health Network that has just gotten established about a year and a half ago, and we just elected our first board, and I was elected to be the board president of it, and we're in the process of coming up with a strategy and what we're going to be doing across UUism in terms of mental health issues. For some of you may know of the organization called Equal Access. It's a UU-wide disability organization, and I'm part of the leadership circle of that. And I'm also on the UU Addictions Ministry team. So I'll start out with a story there was a family it's actually our congregation, who had a daughter. One of their children was seriously mentally ill and was hospitalized in a psychiatric facility. And the parents both worked, and they were faithfully going every day to this psychiatric facility, and to be with their daughter in the evening. And there one evening or one day, the husband got a phone call and said, from the church pastoral care team, and said, so and so from our church is in the hospital, and we're all trying to bring food over to their house and so forth. Could you possibly create a dish and bring it over? And he said, being the type of person he was, he says, oh sure, I can help. So he put together a casserole and took it over to the other people's house, and he rushed off to the hospital with his wife to visit their daughter. And after a while, his wife said, wait a minute, we have somebody that's in the hospital in our house. There's nobody bringing us casseroles. And is there a double standard here? And what I'm telling you is, yes, there is a double standard. sometimes mental illness and people being in the hospital for mental health problems in the psychiatric ward doesn't get advertised to the rest of the congregation as somebody that we should be coming over to their house and bringing them a casserole. And some of it could even be on the part of the family themselves. They didn't ask for any casseroles to be brought, and I think sometimes when we have folks that are in the psychiatric ward, and then some of this could also be true of rehab for addiction purposes, that it isn't something that we rush off to somebody's house or that we tell everybody about, and we want them to come to our house with a casserole. So what I'd like to say is this has to stop. We should be bringing casseroles to people's homes if they have people in the psychiatric ward. There are the prevalence is very high in the United States. 1 in 5 American adults every year have experienced mental illness in every year. Nearly half of those people coexist with addiction. And this situation is getting worse. In fact, this is a chart I got from the National Alliance on Mental Illness, NAMI, from a couple of years ago, and the more recent one I've seen from them is 1 in 4. And I know things are getting worse since the pandemic. So you could say that on any Sunday morning, the pews or your Zoom screens now are filled with people living with mental illness and their loved ones. Many of them are sitting there suffering silently, and many of them are coming to church to get hope to make it through the day to the next week. Just a few statistics. The schizophrenia is prevalent in about 1% of people in the United States. Bipolar disorder, about 2.5%. Depression, 7% people in the past year have been diagnosed with depression. Anxiety disorders of various kinds like PTSD or obsessive compulsive disorder or various phobias, 18%. And addiction co-occurs with mental illness about half the time. So that's a lot of people that you're talking about. And just to let you know, when I use a few terms interchangeably, so if you hear me talking about these things, a mental health challenge, a mental health issue, mental health difficulty, mental health problem, mental health crisis, I use those terms pretty much interchangeably. The term that I use for people who live with it is a person with lived experience or a consumer. And the terms I use for when a person has been diagnosed with a mental health problem or is a mental disorder or a mental illness. So just so that you know what I'm talking about when you hear me say these words. If you look at the American Psychiatric Association, their official definition of what mental health is the successful performance of a mental function resulting in productive activities, fulfilling relationships with other people, and the ability to adapt to change and cope with adversity. The definition they have of a mental disorder is a behavioral syndrome creating impairment or distress in thinking, mood, or behavior that has been diagnosed by a mental health professional. And the most important point of this is that it isn't true that all people are either mentally healthy or mentally disordered, but the fact that there is a continuum between those things and that people live across that continuum during their lives and sometimes are, a little more troubled than others and sometimes a lot more mentally healthy than others, but it is a continuum. The recovery from mental health is, this is from a working definition from the Substance Abuse and Mental Health Services Association, the federal government association. That mental health recovery is a process of change in which people improve their mental health and wellness live a self-directed life, and strive to live to their full potential. It doesn't necessarily mean the absence of symptoms or the absence of need for medications. People can say that they are living in recovery and still have times when they're going, um, having more troubled times than others. So I'll tell you a little bit about my story. Um, this is a picture of me with my 10-day-old daughter. This is from 1978. That's 42 years ago. I had, shortly after actually this picture was taken, um, a severe postpartum depression that in which I was suicidal, and I was hospitalized in the psychiatric ward. After that experience, I was able to, go back to my position, and after that, but I felt like I was a damaged human being, and in a sense, I had, I think, internalized the stigma that our society has about mental health and applied it against myself, and thought that there was something definitely wrong with me. I didn't want people to know that that had happened and all that kind of thing. And this went on for a number of years, almost 8 years. And I finally decided I wasn't going to live my life like that anymore. And I went back to my psychiatrist and told him that I really wanted to be have more in-depth conversation and set of experiences to understand why I was so miserably unhappy. And I would willing to do anything to make a change in my life. And he suggested as part of this process, and I didn't realize how fortunate I was at that time. He suggested, he asked me if I knew how to meditate. And uh, my first thought that I went through in my mind was, you got to be kidding me, sitting around and doing nothing. How does that kind of help anything? But I had promised myself that I would do anything. I trusted him and I would do anything to try to make a difference. And so, he gave me a book and he showed me how to, uh, you know, meditate. And, first it was only like 5 minutes and maybe 10 minutes. And um, after I think 2 weeks of doing this, I mean, that was literally the only time that I wasn't rushing from one thing to the next, was when I was meditating. Um, I went back to him and I said, I don't know where it came from, but I'm happy. And I'll never forget what he said. He pointed at me and he said, it came from you. And that was just when my whole concept of myself as an individual, that something was right about me as an individual, and that happiness came from within, and that I had the ability to give myself that. And it was really a spiritual experience. And I was so happy that I thought, well, I don't need to take these medications anymore. I'm just stop cold turkey. And that was not a wise thing to do. If some of you have ever been through that kind of experience yourself or with a family member, I became psychotic. And within a couple of weeks, I was back in the psychiatric ward, but I was not as disturbed at being there as I was when I first went there. And in fact, my psychosis was that I thought I was dead and that the psychiatric ward was heaven and I was one of the souls waiting to be reborn. And don't ask me where that came from, but that is what I thought. Um, when I was able to, but they put me back on medication and I came back to more everybody else's idea of what reality was. But I was a changed person, and it isn't too um, strong of a way to say I was reborn um, and found, you know, that I could uh, be a happy person. I could live a fulfilled life. And I eventually ended up changing my career. Previously, I was a software engineer working for IBM, and I changed my career at age 50, and I went back to seminary for 4 years, and with the intention of doing mental health ministry as a community minister. So that's sort of my story and why this is so important to me. I want to talk a little bit about what a mental health ministry is. And the idea, one important idea, so if you don't remember anything else, I hope you remember this, that when a person uh, recovers or becomes healed from a mental health problem, they there's a lot of different aspects to their life. There's an emotional piece, there's a social piece, who they're socializing with, occupational piece, what they're doing with their time and their life, financially, having enough to support themselves, environmentally, in terms of being in touch with the world and being in touch with, something that's outside in nature, physically in terms of taking care of themselves physically, intellectually in terms of learning new things, spiritually in terms of taking care of themselves spiritually. So it used to be the old idea was, oh, you just give them a couple of pills and they'll be okay. That's really not the case at all. You look at the whole picture, the whole person's life, and you do things to uh, make that person's life whole. And the point that I make in the book is that people in congregations can help in some of these areas that are not covered by professional mental health services. So certainly the spiritual aspects of it. There's social community aspects of having a community that you can call things. Intellectually, how you can have adult education that people can learn things, environmentally, get involved in environmentally uh, things, and helping people to understand what their occupation and their purpose in life is and how that's important. All of those things are what average individuals in congregations can do. And in fact, when I started going to church after I was out of the um, psychiatric ward the second time, that community that I was with gave me a lot of these things, that and I really credit them for helping me to recover. And I want very much for other people to have that kind of experience as well. So a mental health crisis is a spiritual problem as well as a psychiatric one. Many people feel existential doubts about their selfhood, their truth, meaning, love, and their own agency in uh, making their life decisions. And it may undermine their faith in the divine or their belief in justice. One of the things I discovered when I was, you know, trying to learn about all these things, and is that it's very common that the founders of religions and their followers have experienced spiritual awakenings. Some of them might, if you read the accounts of them, sound to me very much like a psychotic reaction, sort of like what I had when I was hospitalized the second time. And all of the leaders of the Abrahamic uh, religions, Abraham, Moses, Jesus, Paul, uh, the LDS Church, Joseph Smith, Muhammad, certainly within Islam, George Fox and the Quakers. There's a myriad of Hindu mystics and the man who became the Buddha, and our own Ralph Waldo Emerson, and if you read some of his things, had mystical experiences. So this is not unusual. In fact, that's where a lot of this comes from. The picture of the man there is Dr. David Lukoff. He had a spiritual experience, and he was describing it to me when I took that picture, where he saw the uh, picture of someone's hand going like that, and for some reason he had a spiritual experience when he saw that. So spiritual practice is helpful to many people with mental health problems, and there's even a study that was done about a little over 10 years ago that when they asked people about their coping skills for mental health problems, spiritual practice was the number one thing, mostly in terms of prayer and meditation. Um, there's a number of examples of it that I have listed there. Many people say music is sacred music, spiritual direction. People engage in Tai Chi, Qigong, or yoga, chanting. I guess I have spiritual direction there twice, don't I? But there's a lot of people engage in spiritual practice, and it is like the number one coping skill, not only for people with mental health problems, but also their family members. And this is despite the fact that um, that the psychiatric community, starting with Sigmund Freud, um, thought that religion was just an illusion and something that people were projecting and in unhealthy way. And in fact, it's one of the more healthy things you can do. So, what is it that a person can do? What a congregation can do? And uh, one thing you can there's one-on-one support or helping each other, and hope is a really big thing. It is the first step in recovery, according to there's a man, Dr. Mark Reagan, who was a psychiatrist and worked with many people in Long Beach, California, and he was renowned for being able to take people with one of the more serious mental illnesses, um, uh, schizophrenia and bipolar disorder and so forth, and he was able to have them turn their lives around. And he developed this model that at the stages that people go through when they are starting to get recover from a mental illness. And the very first stage that he said is hope. And it doesn't mean false hope, but it means a hope that something possibly could get better. And sometimes we as congregation members might need to hold that hope if they don't see it. So, tell you a story from my own life. The first time that I was hospitalized went back after my daughter was born. Um, I was just completely hopeless. I thought my life was over. I thought my family would be better off without me because I was unable to do anything. And um, my doctor told me, well, we should be able to help you. And I thought, well, what does he know? And my family said, you'll get better. And I thought they'd be better off without me. And then when I was in the hospital, I sat down with another patient, the woman who had been there for a couple of weeks and was about ready to be discharged. And she told me about how ill she had been when she got there and how she had worked with her psychiatrist and with the other clinicians in the hospital, and how much better she feels now. And when she told me that story, that was the first time I thought, maybe there's hope for me. And that was really the start of my recovery, is listening to another mental patient telling me that they could get better. This is one reason why I believe so strongly that peer support is really important, and why I work in a peer support organization, because I know that somehow peers can be the ones that can give hope more than anybody else just by being who they are. Another support is just presence, just being present with a person. Um, being present with someone is a gift that you give them. And being present means that you're with them and you're actively listening to them without judgment. You're not trying to give them advice or tell them what to do. You're validating their feelings. The book, I have several pages in the book that go into more details about how to do active listening. And I'll tell you a story from my ministry. When I started as an intern at a large church, and I think it was the first month that I was there, I had met a number of the people in the congregation, and one Sunday morning when we were all sort of rushing around to get the service set up and so forth, this one woman who I knew had some serious anxiety problems came up to me and she said, "Barbara, I just don't know what to do. I'm just so distressed. I don't know what to do." And of course, I was thinking, "Oh gosh, I'm the intern. I'm a minister. I don't know what to do either." And so I suggested to her that we would go off and sit together in a room that wasn't being used then. And so we sat together, closed the door, and sat together with her. It was in the library of the congregation. And I sat there holding her hand, and I was thinking, what can I possibly tell her? I'm such a failure. I can't think of anything to tell her. I'm going to be a failure as a minister. What can I possibly do? But I was sitting there silently holding her hand. And after a couple of minutes, she said, "I feel so much better just being here with you." And it was like, duh, you know, what a lesson for me that she just gave me. My presence was enough. Just being there with her, caring about her, was enough t- to make her to take the edge off of what she was feeling. I mean, of course, it didn't solve all of her anxiety problems, but it was enough for me to realize that presence was a gift, and my being there with her was a gift. And anyone can give presence. Anyone can be there for someone, just to be there to care for them, let them know that you care. Um, I've also had stories, from my own work in the mental health center uh, that have taught me this lesson as well. There's a story that there's a one woman who had, I knew her for 2 or 3 years, and I know that she had had a number of bouts and had been hospitalized a number of times, and I could see that her mental state was disintegrating, and so I talked to her and I said, "Do you think it's time for you to go in the hospital again?" Because I knew that she got better when she had been hospitalized. And so she agreed. And so I drove her over to the psychiatric hospital we have here in Fremont. And I sat with her when she was being, uh, they were taking her history and we were filling out forms and getting insurance cards. And I sat there and um, with her, holding her hand, waiting until they were going to admit her. And finally, they did admit her. And um, it was about 2 or 3 weeks later, after she got out of the hospital, she took me aside one day and she said, "Barbara, I just want you to know that that day when you took me to the hospital and you sat there with me, waiting for me, sometimes I think about that and that gets me through the day, just to know that you did that for me." Just another lesson. I mean, this brings me to tears to even tell you this story. I mean, just another lesson for me. I mean, it was a gift for her to tell me that, and I realized it was a gift for me to have done that for her. And that is something that, I mean, don't have to be uh, a licensed clinician to give that kind of a gift to a person. The human presence. Um, okay, another important aspect of mental health ministry is something called empathy, and that is the ability to see the world as another person sees it. Um, you don't have to agree with them with the way they see it, but at least trying to see it as they have seen it. And a story that I'd like to tell about this is sometimes there are folks that come to the mental health center where I am who hear voices that no one else can hear, and they'll um, talk about that they're, paranoid that the CIA is after of them or something. And instead of saying something like, "You're crazy, no one's saying anything, you're just hearing things," or "You're crazy, the CIA isn't after you." Instead of saying that, you say something like, "It really must be difficult to hear things like that. It really must be hard to feel that the CIA is after you." I mean, validating their story, giving them, the feeling that somebody else can understand what they're going through, even though you're not feeling it yourself. Doesn't mean you have to agree with them, but it's people that are delusional or believing things that um, even demonstrably not true. Um, a lot of times, what they need is somebody to understand how difficult that must be for them to be going through that, rather than someone telling them that they're delusional. um, so one of the things a congregation can do is to create a safer space for somebody to be, and that is basically ending the silence around mental health problems and the secrecy around it, because some people don't want to talk about it, and I know that I was there myself, and the shame that some people feel about it. So some way that you can do that, and ending negative comments that people make. Um, I tell in the book about a woman who at a UU coffee hour heard people. Let's see, what is it that they said? They said things like, "Oh, well, watch out for him. He's been in the mental hospital before. Watch out for so and so. They're crazy. Everybody else in their family is crazy." Um, you know, things like that. And I have a whole list of that she told me that she heard at UU coffee hour. I mean, people should not be saying stuff like that. It does not. She didn't feel safe in letting other people know that this was in her family, and I don't blame her. Knowing that people would think things like that. So some way of making it not okay to make derogatory comments um, about people with mental health problems, or calling people crazy, or even using the word crazy to be in a pejorative sense. So, I mean, it's a little culture change that we have to have here to make that some of these things happen. So, I'll tell you one of the most effective stigma busters that I have discovered as part of my ministry. And that is when I'm invited to speak at a congregation. Um, I they I usually talk. I have sort of a standard mental health talk that I have that the first time that I visited a congregation, to talk about how people. It's basically the model of how people uh, recover from mental health, from starting with hope and then doing several other steps recovering from mental health problems. And then I tell a little bit of my own story, not because my own story is so incredibly important or unique or anything like that, but because I know when somebody, you know, respected person stands up in front of the congregation and tells their story, that it makes it safe for other people to acknowledge to themselves that that is something that I've done, that that's something that they have lived with too, or that someone in their family has lived with. So then at the end of the sermon, and after I finish the sermon, I say that in an act of public witness, I would like to call on those of you who are living with a mental health problem, or a loved one of yours is living with a mental problem, to just stand as you're willing and able, uh, as a way to demonstrate to this congregation what it is that how prevalent this is. And every time I've ever done that, um, somewhere between 80 and 100% of the people will stand up. And they all are looking around saying, oh my gosh, Bill, it's all these people standing up that are having all of these problems. Oh my gosh. And then coffee hour, they're talking about it. They're saying, oh, my sister had bipolar, or my brother is depressed, or I went through a spell like that when I was younger, or whatever. And it makes it safe to talk about it when they realize that almost everybody in their congregation has been affected in some way, either they themselves personally or a loved one of theirs has done personally. And I'm not particularly unique. I mean, I've told other people about this doing this kind of a thing, when they have a service that's devoted to mental health. And I've told them, I've encouraged them to try this public witness at the end of their sermon. And they all tell me the same thing happens in their congregation. It's almost everybody stands up, and no one can believe how many people are standing up because they've been silently suffering there for a long time. So I will leave this with you. If you ever give a sermon in your congregation about um, mental health problems, to try to do that, because I think it's the most effective way that you get rid of the stigma. Um, so I talk a little bit about suicide. I have a picture here of Kevin Hines. He's one of the few people that jumped off of the uh, Golden Gate Bridge and lived. And he now is devoted his life to doing suicide prevention. And this is a picture from his latest. There's a movie that was made, a documentary that was made of his life, and it's called The Ripple Effect. Knowing that when you tell somebody who's suicidal that it is possible to get better, and you're not always going to feel this way, that it has a ripple effect and of improving it. So a suicide in a congregation can be really deeply troubling certainly to the family, to friends, and to fellow congregants. People that have are actively suicidal and have an intent and a means to do it really need to be in professional mental health care, or some place that is going to treat that seriously, and where they can tell their story and come to an understanding. I once took a class called Interrupting the Suicidal Mind. And the guy who taught it was a man who was in his local community, I think it was in Florida somewhere, that whenever anybody came into emergency ward after a failed suicide attempt, that they would call him in to come and talk to that person. And he would come in and talk to them to try to understand what was going on. And we asked him, what did you find the most effective thing to be when you were talking with these folks? And he said, what I try to do is to find something that I authentically like about that person. Something about them, the way they look, what their role in life was, or something about them that I can authentically appreciate and like. And I concentrate on that when I'm talking to them. I don't necessarily say out loud I like about them, but I concentrate on them, and that somehow that they can pick up on that, the fact that here's somebody that actually thinks that there's something redeemable about me. Maybe I'm not so pathetically a failure as I thought I was. Here's somebody that actually cares. And again, hope, empathy, compassion is what helps. Um, and I have been on teams that have gone out on the Golden Gate Bridge on holidays, and there's a whole team of folks that go out out on holidays to watch out for folks that are that might look like they might be having problems, and they tell us to make eye contact and to be friendly and smile and try to drum up a conversation with somebody, and as a way of just affirming their human existence. And Kevin Hines, this guy, said if somebody had done that to him that day, he wouldn't have jumped. If somebody had been friendly and smiled at him, and even something as simple as a smile can um, just surprise the kind of difference it can make for some people. Um, and also, when there has been a suicide in a congregation, there's it, you know, having empathy and compassion for the family members, and letting them process it, finding them suicide survivor groups to go to, talking with them, and officiating at their memorial service or coming to their memorial service for the person, that kind of thing is really, really important. So now, if somebody wanted to know what are the steps that I need to go through to create a mental health ministry in my congregation? So these are steps that were first created by was a Dr. Gunnar Christensen. He was uh, the founder of the what they call FaithNet in the National Alliance on Mental Illness, and he came up with these steps that are more or less in order what you should do. At least the first few are in order. First, to get the support of the minister and the lay leadership, so that you're not just off on some team in the corner somewhere and nobody knows what you're doing, and they don't agree with what you're doing. So you get the support of the minister and the lay leadership, and then you develop adequate guidelines for appropriate behavior in in a congregation, and that's usually a behavioral covenant, a disruptive behavior policy. The UUA website has ideas of how to go about doing that. A lot of congregations have them, and you can even just Google those behavioral covenant UU, and you'll come up with a whole bunch of them, and a disruptive behavior policy, so um, that people know what to do if there is somebody who's disruptive. You have a worship service that focuses on mental health. You offer education to the congregation about mental health issues. Reading my book, for example, is one thing that you could do. I did write earlier in my ministry, I wrote a curriculum for education that's available on my website. Um, some sort some sort of support for RE children, especially kids that might have ADHD, that are difficult to have them sit still in a class, and having some way of getting support for them. Um, Support groups, either creating a support group or finding local support groups to refer people to. So getting referrals. I did this in my congregation by just asking folks if people that had some sort of therapy, if they had someone that they would be comfortable in recommending to a fellow congregant as someone. And I didn't have to say who it was that did the referral, but just having a list of referrals that of people that um, their congregants were comfortable about. And then a companioning program. This was a companioning program was first, I think, developed by a United Church of Christ minister. He, for many years, was companioning people in the Seattle area, and he developed this companioning program. And it's basically how people can be companions to folks that are having difficulties. So for example, if there's someone in a congregation who's having a difficulty sitting still and maybe even being disruptive, one of the companions can um, be, sit next to them and quietly suggest, maybe you and I can go out and talk privately outside. So this isn't like getting rid of a person, this is taking care of the person, because that's what the kind of care that they need. And he has this whole companion program is on the website of Pathways to Promise, which is a interfaith ministry, mental health ministry website. He has a whole program in education for people that are interested in becoming companions to individuals. I really recommend that if anybody is interested in following that. And finally, having people that are um, you know, give pastoral care to individuals. You bring a casserole when somebody is having difficult time, and also spiritual support if somebody's having spiritual issues. So this is sort of an outline that was developed, and I think it's at least the first 3 or 4 steps in order, to make sure that that you have your ducks in a row before you start, getting into it in a heavy way, is been a model that has worked for many congregations. So what is it that I have a lot of detail about this in the book, but what is it that people can do that helps? And I collected a whole bunch of things just from people that I've worked with, for the last, since I started my ministry in 2004. And they fall into these basic categories of getting professional help or peer help, from people that can be helpful to you, taking care of your body, getting nourishment, physical exercise, and so forth, managing your stress, knowing what your triggers are, and managing your stress, being aware of your emotions, um, uh, and enriching your life in some way, and uh, learning new things, engaging in some hobbies in some way, or some way to enrich your life, and engage with your spirituality. There's a lot more details about this in the book, but those are the basic categories. And what helps the family of people who have loved ones that are living with mental health difficulty. Um, I have this picture from NAMI, the National Alliance on Mental Illness. They have a wonderful program called Family to Family that teaches families about mental illness. Um, Sometimes getting professional or peer help from them. And NAMI is a great peer group for families. Learning how to communicate effectively, and go into that in a little bit of detail in the book of how to communicate with people effectively. Learning how to, or helping your loved one live with their situation, whatever their situation might be. And then, of course, having a life of your own, so that, your whole life isn't just wrapped up in the other person's thing. Now, I wanted to also get into this, if I could, in talking about mental health as a social justice issue. There's a lot of things that make it hard to get mental health care. Insurance and money issues mainly. Coverage sometimes non-existent or inadequate. Some practitioners won't take insurance. They just make you pay for it outright. And the cost of good care is prohibitively high. Psychiatry, at least in my area, is like $300 or $400 an hour for a psychiatrist, and many of them that charge that much will not take insurance. They'll give you a receipt so that you can file it with your insurance company, but you don't get reimbursed at anywhere near that rate. There's a lack of a wide availability of mental health treatment. It's hard to find a practitioner that accepts new patients. Um, and then a lot of times, if you find a place with sliding scales, the people that you get are short-term interns that won't stick with you for the long run. They're gone after 6 months. Um, And then alternative therapies that people sometimes are very helpful for people are sometimes too costly and not widely available for many people. Sometimes there are issues finding support in some populations. The Black and Indigenous and people of color sometimes find it very difficult to find somebody that understands their point of view. LGBTQ, my gosh, I mean, homosexuality used to be a in when they first were defining psychiatric disorders, that was a psychiatric disorder, so they're justifiably wary about some uh, of the mental health standard mental health treatments. It's also sometimes hard to get somebody that specializes in teens or younger people. If someone doesn't speak English, that makes it very difficult. And some communities have significantly more stigma around mental health issues than others. In my own experience in Fremont, a lot of Asian communities have significantly more stigma than even the standard American communities. They won't even let their family. They won't let anybody know if someone has in their family has had a mental health problem, because no one will marry anyone in their family if someone in their family has had a mental health problem. I mean, it's just really that bad in some places. And then there's a lack of availability of mental health care in some areas. The prisons and jails are full of people that have mental health problems. And you probably have heard that engagement with the police can lead to incarceration or maybe even death. A friend of mine, a son was killed by a police officer who she had called out to help out in a situation. It was really, really tragic. And when they're they get little or no treatment. They get medications, and that's about it. Um, and there's a sort of a mantra about some of the people um, that some people have used at trying to get in trying to get care for folks in or get people with mental health problems out of jail. They say don't get well in a cell, and that's been sometimes successful in diverting some issues. And sadly, it's true that sometimes the most troubled people get the worst care. Um, the picture here is that I one time had an interview with a chaplain, a prison chaplain, the man on the left there, and a former prisoner, the man on the right, and they were talking to me about the mental health problems that they had experienced in jail. It's really, really tragic. However, there are some low-cost options. There are many fine peer and self-help support groups that are free or very low cost. The one that I work in is supported by our county, and it is free to people that come there. Some local governments have social services that are free or on a sliding scale. Um, Alameda County Network of Mental Health Clients, that's the organization that I work for. It's supported by our county. Um, some people can get online support by uh, in some groups. I mean, I know there are some NAMI support groups that are free to people, and they're now having them online because of the pandemic. Um, and there were a lot of the suggestions that I have and what helps the individual don't have a cost associated with them. So all is not lost, but still it is pretty tragic where we are. So if you want to work in social justice, these are the basic areas, some sort of economic justice, abuse prevention, some support and treatment for people, involvement in the mental health system. A lot of mental health boards are looking for citizens to be engaged. Publicity and writing letters to the editor, letting people know when there's big problem areas, engaging in some sort of direct service, and volunteering in an agency. volunteering with NAMI, that kind of thing, and some sort of organized activism. So those are the basic areas that I see where social justice for mental health is. I put together a bunch of resources here. There is an organization called the UU Mental Health Network, uumentalhealth.org, fairly new organization that I told you about before that I'm the board chair of. There is a UCC for the United Church of Christ Mental Health Network that's been active for many years. They do a lot of fine work. The Pathways to Promise, which is I told you about before, that was an organization for this interfaith organization for mental health issues. Mental Health Ministries is another interfaith organization, and it's a Methodist minister is the one that runs that. The National Empowerment Center is works with a lot of people, mental health consumers, to try to empower them in order to recover from their mental illness. I've mentioned before the NAMI, the National Alliance on Mental Illness. They have all kinds of stuff in their website. There's a special section of their website that's just for faith communities. SAMHSA has a lot about recovery on their website. There's a program called the Wellness Recovery Action Plan, or WRAP, W-R-A-P, that was designed for people to learn how to be more conscious about their own issues and how to become active in helping to solve them. I really recommend that as well. Emotional CPR is something that was a program that was developed to help community members to learn how to be supportive of people having mental health crisis. Mental health first aid is an education program that is actually international at this point, that educates people in communities about mental health. There's the UUA's Safe Congregations website for developing covenants and disruptive behavior policies. There's a number of things that there's a book that was written by a man named Larry Hayes. He's a UU and very active in mental health reform, and he wrote this book several years ago, Mental Illness in Your Town, 37 Ways for Communities to Help and Heal. Really good book, by the way. Then there's a program, a website called Mind Freedom International. They do a lot of advocacy work for people who have had the involvement in the mental health system that is not been helpful to them at all, and they help them to free themselves out of the mental health with abusive situations that they've been in. There's a Coalition for Disability Rights, and then there's some addiction-specific resources in the UU Addictions Ministry. There's an Addictions Ministry Handbook by Dennis Meacham that some of you may know of, and SAMHSA has all kinds of good stuff on their website too. So this is my contact information, com_minister@mpuuc.org. That's my church's website, and my email, and that's my phone number, 510-796-5722. And I guess we could have questions. So that's about an hour.
Yeah, exactly an hour. Thanks, Barbara, so much. It's so good to be in your presence again, even virtually.
Yeah.
So that's a lot of information, and I really appreciate it. I assume that some of the folks here have questions or comments, and probably the easiest way to do this is if you have a question or a comment, just raise your hand. I'll call on you, and then you can unmute yourself. Any thoughts? Any questions? Graciela. Yes. Oh, and you should introduce yourself and tell where you're from, what congregation you're from.
Okay, thank you very much, Barbara. Thanks so much for all your presentation. I deeply appreciate. So my name is
Thank you.
Gisela Rios. I'm from Brazil. I live in Connecticut, in Hendon, and I'm a member of USN8 in New Haven. Our Reverend now it's Reverend Lynn Sanson. She just arrived to our church a month ago.
Mm-hmm.
Um, I am a psychologist and I work with people in process of recovery
Mhm.
at Yale in a program called Program for Community Mental Health.
Uh-huh.
And I work with Dr. Larry Davis, so maybe you hear something from him. He's a huge human being that has been working people in recovery for a long time. And also he was the one that implement peer support uh,
Oh.
and also work with John Strauss. So, but my question is, I create the mental health group in our church in New Haven.
Mhm.
And we have been offering several these programs and initiatives that also family to family like you have in yours. We started about 6 years ago, and we
Mhm.
have been trying to normalize the conversation around mental health and make turn this conversation like you talk about your diabetes or you talk about your I don't know, your birthday or
Right.
celebrate anything that makes sense in your life. It's normal to talking about. So that's what you're
Yeah.
trying to do. But engage a congregation in a conversation about mental health, it's extremely challenging.
Yeah.
And I have been trying to do this in different ways, not only promote education, but invite people who has diagnosed in mental health to organize a talent show and show what they can offer and invite people to come and engage in a conversation.
Mhm.
So how you engage people in your conversation in your congregation to engage in all your programs and start to enjoy and talk and integrate with thoughts and ideas and actions in the mental health field. Because I have been trying this in different ways, and to be honest with you, I don't think I have a lot of success on that.
Ah, okay. Have has do you have the support of your minister?
Yes, we always have the support of the minister.
So have you had any like a church service that focuses on mental health?
We have a part of the service that we can come and share experience. Who had lived experience come and share with the entire congregation. We have been
Mhm.
doing this for 6 years, but still, I think it's something people refuse to engage in talking about.
Yeah. Well, I guess I'll just say again what the most effective thing that I've seen is, of course, it's hard to do on COVID now, because you're in COVID. But when I was in a congregation, when I asked people to rise in body or spirit if they or a loved one was living with mental health, and when almost everybody stood up, um, then it was all of a sudden it was safe to talk about it. That was the most effective thing that I've seen. But I don't know how to do that in COVID. So that that um, that's but and what other people have told me is that the ways that they have introduced it in their congregation is, first they have a church service, and then they had, like, after the church service in their fellowship hall, they had tables set up with literature about various different kinds of mental health things. And when people went into their fellowship hall after the service, then they could get into conversations with people like that. But gosh, yeah, it's hard. um I don't know, talking to Yeah, I guess you said you had people come telling their stories of lived experience. That's really important. You know, having a board member or the minister tell their experience, that's even more effective. You know, because then folks will say, oh, okay, well, you mean these respected people have these experiences too? Yeah, okay. You know, but thank you for doing what you're doing. I mean, it sounds like you have a lot of good ideas about it, you know. And are the family members of the people, you know, engaged in it as well?
But you say from the family to family?
No, I guess if you have, like you said, you had some of these events, and were the family members of the people that were participating supportive of those events too?
Yeah, so our group, we have people in our group as a family member. We have people in our group who had lived experience.
Okay.
Yes, but
Yeah.
that's small. It's
Yeah. Yeah. The stigma is there, you know, the stigma
yeah,
is there,
it's there.
and it's hard to get rid of it, you know. I mean, I know because I used it against myself for 8 years, you know. So, and it's real, you know, and it's harmful. And thank you for trying, you
Yeah.
know.
Thank you for sharing
Okay.
your story. That's an
Yeah.
inspiration.
Okay.
And I would like to connect with you afterwards.
Please do. Yeah. Okay.
Can I just add that when we launched our mental health ministry at the church in Manchester, it had to be something like a decade ago, maybe even longer. We started out with some support groups. We had a support group for people who were living with mental illness or in recovery, and then we had a support group for people for family members. And one of the things that dawned on me after a while is that we had set these up, but nobody had actually asked for them. And so the people who were in them, I think, were partly doing it because they knew we wanted to make this big push and make mental illness speakable and reduce the stigma. But after a while, they just stopped showing up. And when we asked them, they said, well, you know, I go to NAMI or I've got my therapist, and I don't know if I need to come to yet another meeting. So we realized, okay, so this was serving a purpose in that because we were running these programs, it was making mental illness visible without the stigma, and that mattered. But the program wasn't actually working for people, so we stopped doing it. But what we try to do now, and we haven't done it with the pandemic, but we run twice a year or at least once a year a mental health ministry summit. And we try to get like an interesting speaker to come and address us, or we have some interesting activities, and we say all are welcome. So we say if you're living with a mental health diagnosis, or you're in recovery, or you're a family member, or you're a provider, or if you're just interested, all are welcome. We try to do it on a Saturday morning and have food, and we can get 20 or 30 people that come to it. But one of the things that I think is valuable is just the publicity. So the publicity goes out there as much as we can. A lot of people see it, and it has the impact of making mental illness speakable in the congregation, because here we are speaking about it. So even if people don't show up, they know that we had this event and that this is the priority of the congregation.
Yeah, thank you for making that point. Yeah.
Other thoughts, questions, comments? We have the author of the book here in our presence right now. Sheila.
I had to unmute. I just wonder what the pandemic is doing to mental health and how congregations deal with mental health. We've been so fortunate. We've had some amazing services since last March, but we're not touching each other. We're not literally going to have coffee after the service. We're not shaking hands or hugging. How do we manage to maintain mental health and the mental health of our congregation at a distance?
Yeah, it's really tough. One of the things that we did in the the UU Mental Health Network is, we sent out a survey to as many people as we could, in UU organizations that we had, and asking people, what is it, um, what is it that's helping you right now? What is it that's helping your congregation? And what is it you'd like to see? And how is it, what is this, what is your emotional state right now? You know, all the way from doing okay to I'm in crisis, you know, and then ask them, how has the pandemic affected your mental health? And, you know, that we said 0 was, I guess it was from 1 to 5, where 1 was not at all, and 5 was really a lot. And most of the people said 4 or 5, you know. So it was just a real, you know, big improvement. And I not improvement, but a lot, big increase in the numbers of folks that have mental health difficulties. And I know that our local NAMI chapter they have a warm line, and they're getting just inundated with telephone calls from people because they're, you know, having crisis. One thing that I did was really interesting and sort of counterintuitive that I learned was that even though a lot of this is all happening and there's a lot more anxiety and a lot more need for mental health services, the suicide rate has not changed at all. And I thought, huh, now isn't that interesting? You know, that, and there were some people that actually studied, you know, went through a lot of different places and tried to figure out what is it that, uh, well, I wonder why it is. It's sort of like everybody is getting pushed to being more anxious, but no one's getting, or at least not any more than normal, are getting pushed off the edge, which is an interesting thing. And it wasn't intuitive to me, you know. So, but what the things that we ask people, what is it that works for you, or what is it works for your congregation? Boy, would we ever get a long list of stuff, you know, there's, you know, 20 or 30 different kinds of spiritual practice, a lot of small group ministry. And there are people that I guess their congregations are not offering small group ministry online, you know, and they really wanted to know, how can we get small group ministry online, you know. And I think it could be even that the small group ministry group, you know, UU organization already has some suggestions for how to do it. They just don't know about them yet, you know. So, um, so you know, engagement with their pets, slowing down, getting lower expectations for what they can do personally or in a congregation, and, you know, having all kinds of different special interest groups that they started, you know, that on just n number of different subjects, you know, that they might have. You know, that's about as much as we can do when you can't be in each other's physical presence, you know. You know, just the way that you can be present with somebody is like what we're doing right now. You know, just being, you know, you can see their face right there and talk to them. Um, but yeah, it's a struggle and it's really hard, you know. And I mean, like with the place that I work, you know, it's you know, the folks that we have Zoom meetings with our clients, and some of them don't have computers and don't have cell phones, and some of them don't even have house phones that they can use, you know, and it's really tough.
Thank you for
Yeah.
your input. I should have said
Yeah.
I'm with UUSC in Manchester, and we do a pretty good job, but
Oh, good.
there's always room
Okay.
for improvement.
Yeah, well, good. Yeah, maybe there's some places we can refer folks to. Say, talk to so and so. They're really doing a good job, you know. Any other questions?
Yeah, we have a little more time.
Yeah, it's after 8 o'clock your time.
All right, I'm seeing no hands. So once again, I want to say thank you to Barbara for joining us.
Okay, it's my
It's been
pleasure.
great to have you. There's the book.
Yeah,
The glare on my screen.
yeah.
You can get it from well, where I normally get Skinner House books at In Spirit, which is the bookstore at the Unitarian Universalist Association. But I'm assuming you can probably get it on other places
You
too.
can get it on Amazon.
Yeah.
Yeah, yeah.
So, and I know Graciela just put an article, a link to an article in the chat
Oh, okay, good. Thank you.
on COVID and mental health, and if people want to grab that before we close out.
Oh, thank you. Okay. I will save that myself here. So, um,
All right. Well, Barbara, thank you, and thanks for everyone for coming out tonight. And as we know, the virus is spiking, so please stay safe, wear your mask, social distancing. We love you deeply.
yeah.
And Barbara, I'll follow up with an email, but again, thank you so much. It's great to see you.
Yes. Okay.
All right. Good night, everyone.
Bye.